Hello, Healthcare Experience Matters listeners. It's your host, Casey Callanan, alongside Dr. Joshua Schwarzbaum. I'm going to have him introduce himself to those of you who are not familiar with him. Dr. Josh, take it away.
Hi, thanks for having me again. Nice to be here. I'm Josh Schwarzbaum. I work in emergency medicine, addiction medicine, and personal coaching, helping people find their peace of mind, their calm, their good feelings in today's crazy world. I find that it's something that we all need, something that's beneficial. It's been beneficial to me, and it's something that I try to spread out to the world.
Absolutely. And we're going to talk about finding your place where natural learning can exist. This is a concept that I personally learned about by reading your recent book, and that's called Listening for a Feeling Finds True Healing. It's a guide to healing from the inside out. So, this book, of course, I will link to it in the description of today's episode. But I want to know about more when we talk about listening for a feeling. And it seems so effortless for children to learn a new language versus like being an adult. And I think there's some parallels here to just the place of learning that children are coming from. It seems like they have that clear mind. They're free of bias, and that's able to traditionally have them learn something complex like a new language a lot quicker than an adult. Tell me about that phenomenon a little bit more and how it relates back to the overall theme of today's episode, talking about natural learning.
Yeah, I mean, it's a great question. I think kids are just open to different possibilities, open to new experience. They don't know anything. They don't have any preconceived notions. They're not able to compare their previous experience to this experience because they don't have a previous experience. So all of a sudden that they need to learn so much. They need to learn how to speak. They need to learn how to walk. They need to learn how to, do whatever they got to do. And they do that effortlessly because they're not in their way. They're not letting their thoughts get in their way. As adults, we're comparing everything that we've experienced to what we're experiencing now. And when we do that, we start thinking about things, maybe subconsciously, but it gets in our way. If we're able to really just clear our minds as much as possible, and this is what kids are naturally doing, they don't get caught up in this sort of stuff. If something happens, a kid falls down or they get into a fight, or, I have my two kids, they fight with each other, and then 5 minutes later, they go back and they're playing as if nothing ever happened. But as adults, we get into a fight with somebody and we may go years without speaking to somebody. And why is that? Because we're harping on those thoughts and we're just thinking about over and over and over again about how this person hurt me or what they did or how it wasn't nice. But kids, it's natural. It's more natural for that to just let things pass. And when they let these things pass, now they're back to a place of open-mindedness, of clarity, of allowing new things to come in. So they can learn effortlessly by doing that. And it's a lot easier to learn in that regard because you're just like a sponge that takes things in. But if our sponge is already saturated, it can only hold so much water. So first, for us to be able to do it as adults, we need to squeeze it out. We need to empty some things out to allow something new in. But the kids are they're holding on to what's important to, and then the things that aren't, they effortlessly, they just let it go. And then things don't bother them as much and allows them to learn, I think, faster and to be more attuned to this. And it's something that we can learn as adults from kids, from watching kids.
As a healthcare provider, I'm curious how keeping an open mind and that childlike curiosity has helped you dealing with patients and communicating with patients. Has it been helpful to take that childlike curiosity approach to dealing with patients?
100%. I mean, it helps with diagnosis, first of all, because, it opens up a lot of different possibilities. It helps me feel better at work because then I'm not just caught up in what I thought about yesterday or a bad patient interaction I had or somebody who annoyed me or whatever. It allows me to kind of reset and go on and find something new. And the world is an endless amount of possibilities. And we could see this, in healthcare, and especially in the emergency room, but you can see this in other realms too. But in the ER, it's nice because I may see, 10, 20, 30, 40, 50 people a day, let's say. Each person, well, I can build upon each person from the previous patient I had, and it can ruin my whole day. Or I can approach each person as a new experience. And if I'm able to approach each person as a new experience, and sometimes it's not as easy is not as easily done as it is said, obviously. But if I'm able to clear away what happened from the last patient and go into, if it wasn't a good experience, and go into this patient with a new set of eyes, a new perspective, a new potential experience, now all of a sudden everything can shift almost instantaneously from one patient to the next. It just goes from one way and it could flip to the other side and it could flip back too. But allowing this curiosity to happen, and we could see this happening with kids like we spoke about before. A kid gets annoyed, they get into a fight, whatever, then they go back and they start playing. But what happened? Like they were just in a fight. How are they able to reset? We can do this too. We have that same capacity to do that as kids. It's just sometimes we get caught up to no fault of our own. This is just something that happens to us. But we're able to realize that there's a system at play, the system of our thoughts, essentially of our thoughts, of our feelings, and the connection between them. We're able to let our thinking go. And if we can let our thinking go for some amount of time, that is gonna, and if we let our thinking go and get into that place of clarity, of open-mindedness, now we're in a place of natural curiosity, of a place where we're able to learn and we can find things. And we're not stuck on what we believe we knew, or old ideas, or things that aren't useful to us. We can look for something new. And that's something that we have, because the world, and like you see, if you work in an emergency room, or if you work, you don't have to work in an ER, but if you work in healthcare, or even if you work anywhere in any regard, or just you talk to people, you'll see that people will undergo similar situations and come out feeling very differently. So if that's something that happens, then the question is, does the situation have to cause the way I feel, or is there another possibility? And there are endless amounts of possibilities of what could be. Because one day I'm driving on the road and somebody cuts me off and I get upset about it. Why do I get upset? Because I'm thinking that the person did something not nice to me. But another time, maybe I don't care. Maybe why don't I care? Maybe I think the person's in a rush. Maybe I think I've cut somebody off before. Maybe I'm just spacing out in my own thing and it doesn't bother me. But the same situation occurs in various different places at various different times, and I come out feeling very differently. So now when I'm able to see that there's automatically built into any given reality, there's multiple realities at play. If we go see a movie together, I may walk away from that movie saying this was the best movie. You may say this was a terrible movie. You may have one message from the movie. I may have a different message from the movie. Why is that? Because we each think about things in different ways. We each form our own realities based on our thoughts. So if we're able to recognize that this is a system at play, that we're all forming our own realities all the time based on our thoughts, innocently, but this is something that we are doing and we have to be doing, otherwise we're not going to have a reality, then we can start to see that there's multiple realities at play at any given time. And which reality is more real? Mine, yours, the person next to us? Well, they're all equally as real. It's just whichever one we're in tune to. So when I go into seeing patients, if I'm able to see that there's multiple realities for me, for my patients, I have multiple ways of looking at things. My patients have multiple ways of looking at things. Then I just start to see that, okay, I'm feeling this way, or my patient's feeling this way, or expressing themselves this way, because this is what their thinking is telling them at this time. This is what my thinking is telling me at this time. If I create a space for my thinking to be able to go, if I create a space for my patients to potentially let their thinking go, I can't do it for them. They have to do it for themselves. But if I can create a reflective space where maybe they could unload some of that, then things can change. And that's where I think it makes a big difference in healthcare and dealing with people, because people come in with a lot of stress, a lot of uncertainty, a lot of not knowing. And when people are stressed and uncertain, things get difficult and things get tough because they don't know what else to do. And when you start to feel pressure, things start to boil over and people don't always make the best decisions. So if I'm able to recognize that that's what's going on within me, recognize what's going on within other people, then I can take the pot off the stove, let the water simmer down a little bit, and then it doesn't boil over so quickly.
Very good. And these are all concepts that kind of came to me while reading your book, Listening for a Feeling, Finds True Healing, A Guide to Healing from the Inside Out. It's actually written for a child on the surface with the illustrations and the storybook format. However, the takeaways of this book are super, super important for anyone in any field to learn how to be a better listener and overall communicator. I truly believe. Dr. Josh Schwarzbaum, our guest today on Healthcare Experience Matters, I'm going to ask him for any final thoughts on finding your place where natural learning can exist and how it's helped you be a better healthcare provider and listener overall. And then anything else you want to say about the book before we wrap up?
Yeah, I think we all have that place inside of us. And if you don't feel like you're there right now, that's okay. You just find the place and then you're there automatically. And there's no judgment when it comes to this sort of stuff. It's trial and error, and allow yourself to just be and allow yourself to find your curiosity, your place of good feeling. And it comes out. The more you're able to find it, the more you're able to find it again. And look for it within yourself first. It's like when you're on an airplane, they tell you to put your oxygen mask on before, your kid. You got to take care of yourself first. And in healthcare, we're so often ready to take care of other people at the expense of our own self. I was talking to a friend the other day, and he's like, someone was telling me in my hospital that they don't even have time to go to the bathroom. And he's the head of the department. He's like, what does that even mean? They tell me they don't have time to go to the bathroom. Nobody's stopping them from going to the bathroom. Obviously, we want all of our staff to go to the bathroom. But it's a perception that someone has. It's a perception that we have. There's not enough time to go to the bathroom. I don't have time to do what I got to do for myself. No, we have to take care of ourselves. It's absolutely what we have to do. We have to be able to take care of ourselves first, because if we don't take care of ourselves, we're not going to be able to take care of other people. And it's not done in a selfish way. It doesn't mean I'm selfish. It means I have to take care of myself. And that's what it means. Because for me to really be able to take care of someone else, I have to be in a good headspace. I have to be able to be there, to be present, to be clear. And if I could do that for myself, then I could do that for other people. And the more I've found that I've been able to do that, the more I've been able to heal better, the more I've been able to help people better, and the better I feel leaving work and coming to work. And then it branches out into other realms of our life too. And in terms of the book, like you mentioned, it's an illustrated book. There's not a lot of words there. And you could read through the book very, very quickly, and you're going to scratch the surface of it. But read the book once or twice or 3 times and see what comes up and see what you find. Like I said in the book, look for the essence, look for the meaning, look for the feeling behind the words. And that's the same thing as you read this book. What the words are saying, it's my attempt to try to convey this idea in a way that's communicable. But ultimately, what you take from it may be different from what someone else takes from it. And what I take from it may be something different than what you take from it. And there's no right or wrong, but the more we're able to listen to it, the more we're able to just look underneath it and to find that place that we all have inside. That's where the true healing comes about. And it's so important because I found that no matter what people are coming in for, terrible medical stuff, trauma stuff, if we're able to have a clear mind as a physician or as a patient, healing is just done better and easier. And stress makes everything worse. Everything worse. The body reacts to stress, and stress is created within the mind. The more stress we have, the more neurotransmitters, the more stress neurotransmitters we're secreting. And the less time, the less ability the body has to heal naturally. So if we're able to be in that place of calmness, of stillness, of oneness, then we're able to quiet down our minds. And if we're able to quiet down our minds, then we can really find a place of healing, of a natural healing. And that place works very well in and of itself, and then in conjunction if anyone needs any medications or any sort of treatments. And it's something, like I said before, it's available to us all. It's available to every single person on this planet. If only we're able to approach it with an open mind, and we're able to open up our hearts and are willing to take a look for it. And maybe, just maybe, let go of some of the things that we have believe or hold on to be true or based on our experiences, and recognize that maybe there's another possibility out there. Maybe there's another way of looking at things. If we can able to do this, as I've been able to do this for myself, it's really just changed the way I felt about medicine. It's changed the way I've been able to approach my patients and to go into work.
I definitely take so much of your advice to heart, and it has helped me in my own personal life be a better listener and communicator. And I highly encourage our listeners to do the same and kind of take what he's saying to heart here. So his website, Dr. Josh Schwarzbaum's website, is healthyinside.net. And again, I want to thank him for his time today and for joining us on Healthcare Experience Matters.